My name is Dr. Timothy Houchin, or Dr. Tim, and I'm president and founder of 360 Mental Health Services and 360mentalhealth.com. I'm a board-certified child and adolescent psychiatrist. I'm also an adult psychiatrist as well as a forensic psychiatrist. 360 Mental Health Services is a comprehensive, full-service diagnostic clinic where we look at children and adults and evaluate them from a 360 holistic point of view. Often parents seek out my services after being frustrated by what they perceive as an inadequate mental health system. So a child may be able to spend an hour for an initial diagnostic evaluation with a very competent mental health provider, but still leave with a misdiagnosis because that just isn't enough time to get the full picture.
I think sometimes people don't realize the amount of time that it takes when we do an evaluation. When we're putting our heads together with parents, we know we're going to have a better outcome. When you add a third dimension to that with a medical professional, you're going to increase your chances of a positive outcome. And that's really what we're wanting to do for each and every child that we service.
When I went to New York and did my special courtroom training, my eyes were opened to a whole new world. I had as much time as I needed to perform the evaluation. I was given the time to sit down at my desk and put the pieces of the puzzle together to come up with the right diagnosis. If you're not starting with the right diagnosis, you're not going to come up with the right treatment plan, and you're not going to come up with the right answer in court. According to one study, 50% of patients diagnosed with a mental illness don't actually have one.
In working with children with mental health issues, the key is to getting the right diagnosis. A proper diagnosis is not a label for a child. It's actually something that will open the doors to help us provide the care that that child needs. Having Dr. Tim to help us steer those plans would be invaluable.
Just from the school psychologist perspective, a diagnosis may just sound like, okay, we give it a name so that we can move forward, but what that name is does make a difference for these children. It changes the way that we put into place strategies or interventions for those children that are specific research-based strategies. And if you have the wrong diagnosis, we're going down the wrong path.
If I need to spend 10 hours researching, doing psychological testing, interviews, medical testing, I should be able to do that without some insurance company telling me that I can't. And you can do that in forensics, and 360 is a way to shift that forensic process back into the mainstream and practice medicine the way it ought to be practiced. That's the genesis of 360, is taking that courtroom process of evaluation and translating it into an evaluation process for a parent or as a consultation for another doctor. If we can do it for the courts, why can't we do it for parents and caregivers?
When we've had an opportunity to work with Dr. Tim and his 360 team, what you can see is all of these people working together and communicating, and the strategies that are provided and the diagnoses and the evaluation that all guide that treatment plan, and bringing that to the school and encompassing that vision as well. It makes a very big difference for these kids, and those are the outcomes that we're looking for both as parents and as educators.
The ultimate goal of the 360 evaluation is to walk away with a firm understanding of what's going on with your child. Then we can think about a treatment plan that may involve the pediatrician, another mental health care provider. It may involve continuation of services with 360.
I think it's an investment that will pay off well, not only for our school and for that family, but for society and the community in which the child lives as well.
The courtroom expects me to spend as much time as it takes to evaluate a child thoroughly and to leave no stone unturned. As a father, I would expect the same from a mental health evaluator, leaving no stone unturned in my child's evaluation, and that's what you'll get at 360.